investigator from the Hutchinson Cancer Research Center, and I've been involved with the Canary Foundation now for a long time, almost 10 years, I think. I was one of the first investigators to be contacted by Don Listwin, and I work very closely with Chuck Drescher, who is also from the Seattle area at the Fred Hutch, and he's a gynecologic oncologist, and I'm a statistician, and between the two of us, we lead the work that's done in the Canary team. Well, our long-term goals and objectives are to reduce mortality from ovarian cancer and preferably also to reduce incidence. So prevention would reduce incidence, that would be preferable, but if women have to get ovarian cancer, we want to detect it when it's curable. In order to reach our goals with respect to early detection, we have invested 15 years of work in identifying some serum markers to complement CA-125, which has been around for 30 years. And CA-125 actually works quite well, but not well enough on its own. So we have found one additional marker, AG4, that together with CA-125 does actually appear to be viable. I think we might have an approach to screening. In order to work, it needs to identify cancer early when it's curable, but it also needs to be specific, which means that it does not falsely identify healthy women as having cancer. The Markers trial is a randomized trial to try to find out which is a better approach. The first approach is to use just CA-125 as a first-line screen, and the second approach is to use both CA-125 and AG4 every year, or every 6 months actually, in every high-risk woman. AG4 is used in both protocols, but in one protocol it's introduced as a second-line screen, and in the other it's introduced as a first-line screen. But in both situations, the woman would be referred to surgery only if she were positive on both, or if she were positive on one of them and also on imaging. The Canary Foundation has as its goal bringing together investigators with different expertise to all work together. So, for example, on the ovarian team, we have Peter Laird, who specializes in methylation research, so he identifies methylation markers as opposed to protein markers for ovarian cancer. Sam Gambier, who specializes in imaging, so he's bringing 2 new imaging approaches to our ovarian cancer screening strategies. It is critical to have access to these various areas of expertise in order to achieve the goals of the early detection ovarian cancer team.